2015, India faced its first ever dengue outbreak since 1996. In the national capital alone, the dengue menace reached an all-time high with thousands of patients testing positive.
What WHO says is like almost 50 lakh newly infected patients are detected every year. That is international statistics. In India, what we have is almost 50,000 patients are diagnosed every year. That is the 2012-2013 statistics. If you see from last one decade, like from 2005-6, every year it is almost doubling. The number of patients are almost doubling. It started like 2007, 5,000, 6,000 new patients. Then it became 10,000 patients, 15,000 patients like that. And 2013, it is almost 50,000 new patients detected as dengue.
A first-year student of food science, Pavitra was diagnosed with dengue in 2013. For a long time, she mistook the symptoms for a seasonal viral fever.
I had rashes in my lower leg and I had few body pain. But then I didn't go to the doctor because I wasn't sure that I didn't know that it would go to such a serious note.
Dengue fever is transmitted by the bite of Aedes aegypti mosquito. This mosquito becomes infected when it bites a person with dengue virus in the blood. It takes nearly 10 days for the dengue virus to incubate. The dengue-infected mosquito then bites another person and thus circulates the infection.
Dengue will start having more body ache and joint pain, severe body ache, severe joint pain. Because of this, dengue is also called as break-bone fever because the pain will be like breaking the bones. This happens in almost all the patients of dengue. Only few percentage, like 15 to 20% of the dengue patients progress to the next phase, where there will be leaky capillaries. In the blood, there is two component, fluid component and cell component. What happens in dengue is this fluid component starts leaking from the blood vessels and starts accumulating in the abdomen, in the lungs, in the body, everywhere. So that phase, the fluid accumulation phase starts. The patient will behave like a abdominal problem patient. They will have lung problem like they will behave. But actually this is just the fluid accumulation there. And then it slowly progresses to low platelets and patient will start showing signs of bleeding. Okay, this does not happen in all the patients. Let it be very clear. It's only in 15 to 20% of the patients dengue will progress to this stage. In this 15 to 20% where it progresses to fluid accumulations, low platelets, bleeding, in 4 to 5% of those patients will progress to what you call as multi-organ failure.
Without immediate medical intervention, Pavitra's condition had worsened further. From a local hospital, she was shifted to another healthcare provider in the city where she was treated for multiple organ failure.
मल्टी ऑर्गन्स फेलियर होने में री-पिकअप होने में बहुत मुश्किल करके था। वापस से जीतेगा करके वो लेवल तक हमारा मन चला गया। ये हमारा वाइफ डेली आ रहेगा, अभी हॉस्पिटल में के पास मंदिर है, उधर जाके टोटली प्रार्थना करते रहते हैं। हमारा वेल विशर सभी भी बहुत प्रार्थना करके आता है हॉस्पिटल में। मेरा मन बोलेगा ये वापस नहीं आएगा, वो लेवल में चला गया।
When we received her, she was unconscious. She was unconscious. Her liver functions were very bad. There is no specific treatment for dengue. So what we need to do is, whatever organ is involved, we need to support that organ. And viral diseases are self-limiting diseases. You just support the organ till it recovers. She had fluid accumulation in the brain. The brain became tight, so she became unconscious. So we need to support that brain by just giving anti-edema measure. We give drugs to reduce the fluid accumulation in the brain and ventilate her. That itself slowly will settle the brain edema. then she will improve, her consciousness will improve. Coming to the platelets, her platelet was very low. There is no magic treatment to improve the platelets. What we do is, if this low platelet is causing a bleeding, we give platelets. If it is not causing bleeding, we just observe it. In her case, she had some bleeding, so we gave platelets to keep the platelet count around 30,000-40,000. That's what we did. Coming to her liver problem, she had very bad liver symptoms. She went into what you call acute liver failure, caused by dengue. The treatment for acute liver failure is, once again, to prevent further insult to the liver and support the liver by giving some supportive medications.
For Pavitra's mother, it was difficult to see her daughter lying unconscious on the hospital bed for several weeks. Her distress ended the day Pavitra recognized her and called her Mummy.
உள்ளே போனேன்னா நான் மெல்ல கண்ணை திறந்து பார்த்துட்டு அப்படி லைட்டாக ஸ்மைல் பண்ணான். வாயில் டியூப்பு, இங்கே டியூப்பு. அவள் சிரிக்கிறாளா அலறாளான்னு தெரியல எனக்கு. அப்படி என்னை பார்த்துட்டு அப்படி ஐ வாண்ட் டு ரைட்டுன்ற மாதிரி சைன் பண்ணான். அப்புறம் அவளுக்கு பேப்பர் பென்னு கொடுத்து, அவளால் பேச முடியல. மம்மி யூ ஆர் லுக்கிங் லைக் ஜோக்கர்னு எனக்கு எழுதினேன், ஃபஸ்ட்டு எழுதுனது. ஏன்னா அந்த ட்ரெஸ் எல்லாம் பண்ணிட்டு போனேன். நான் சிசியூவில் போகும்போது அந்த கோட்டெல்லாம் போட்டு போகணும், க்ளவுஸ் கோட்டெல்லாம். அப்படி ஒரு ஹாப்பினஸ் எனக்கு.
As luck would have it, the day of discharge from the hospital coincided with Pavitra's 16th birthday. It was a joyous celebration for not just her family members but also the hospital staff.
And then in the morning when I woke up, the room was fully decorated with balloons, and there was a banner next to me which said happy birthday, and it was really nice. And Apollo had arranged a cake for me, and then everyone were there around me, and I was actually sad in the beginning, the day before my birthday, because I knew that my friends wouldn't be there, my parents also wouldn't be there more than 15-20 minutes. So I was actually really upset. I didn't want my birthday to happen actually in the hospital. And then it turned out to be the one memorable birthday ever.
So we kept her in the ward for next 2 weeks, and slowly with the physiotherapy and other supportive care, she improved and weaned the tracheostomy. Then only she went home. Once she went home, she never had any problem.
Pavitra is making the most of her good health by ticking things off her to-do list. These days, she is learning to play the violin, engrossed with her music, she has a newfound appreciation for life.
Hello everybody, I'm here to give you an update on Miss Pavitra, who suffered from dengue. Thankfully, she was diagnosed early. She now has no further complications and is leading a completely healthy life. Her vitals are back to normal, she's going back to college, and she's basically enjoying life just like a normal teenage girl would. Mr. Ezekiel is also, post a very traumatic accident, slowly but surely getting back to very normal life. He's on his monthly follow-up with his neurophysicians and is planning on joining college in the coming year. Folks, critical care requires precise coordination and a multidisciplinary teamwork that extends across a group of consultants across specialties. It requires specially trained nurses, technicians and staff. It is quite literally the difference between life and death. Till we meet again next week on Let's Talk Health, goodbye for now.